understanding the glomerular filtration. Now this, in here there are lots of things of which I'm sure many of you are waiting for certain mechanisms like tubulo-glomerular feedback mechanisms and all those. So, and as well as the factors influencing GFR, how is GFR controlled, how is GFR measured, all these things, auto regulation of GFR. So these, to understand all these, you have to understand the basic concept behind the glomerular filtration. Now here I want to tell you that, there is an artery which is renal artery which comes to the kidney. So just consider this red one. I'm not given a very correct anatomic representation, just for your understanding of the concept here. Now, a renal artery comes and it just divides into various branches, and finally it reaches the kidney, the nephron, near to the nephron of the kidney, and it branches into efferent arterioles. Okay. Efferent arterioles or afferent artery. Okay, then there is lots of capillaries out there. Then it branches into lots of capillaries in the region of the Bowmans capsule. So this is the Bowmans capsule, which leads to the renal tubules, distal convoluted, proximal convoluted and all, and finally the urine gets excreted. So hope you know the structure, the basic structure of nephron. It's nothing. Okay, as you go on you'll understand them better, but more importantly, it leads to the efferent artery or arterioles give rise to glomerular capillaries. Okay, and this is where the actual filtration occurs. Then it then give rise to efferent arterioles, and then peritubular capillaries. Okay, peritubular capillaries, and finally the renal vein. Now into this peritubular capillaries is what reabsorption takes place as well as secretion takes place, okay, during urine formation. So basic filtration takes place here, okay, from the glomerular capillaries into the Bowman's capsule. But whereas the reabsorption and secretion takes place from the peritubular capillaries, okay, that is around the tubules there are capillaries. Simple. Okay, peritubular capillaries. So just understand that. Okay, further I'll give you more understanding as we go on. Now, three things happen as I've told you. One is filtration, the second is reabsorption, that is into the peritubular capillaries, just going back, and from the tubules, okay, from the renal tubules going back to the blood system. Then it can also happen that certain things are secreted into the renal tubules. So three things happen. So let us see some very basic understanding of this area to understand our lectures further. Okay, now one thing which is, okay, I'll just rub all these so that I can explain them better. Okay, now, so one substance, okay, one substance which is only filtered, okay, a substance which is only and only filtered into the Bowman's capsule, and it is excreted completely without any reabsorption, without any secretion, it is creatinine. Creatinine. Okay, another substance which has got a similar kind of excretory method is inulin. Okay, you'll understand the roles of this later on. So it's only filtered, there is no reabsorption, there is no secretion. Okay, now there are certain other substances which are filtered and are also reabsorbed partly. What does it mean? It means that it is filtered, okay, it is filtered, it goes into the Bowman's capsule, and a little bit of it is reabsorbed into the peritubular capillaries. Okay, these are little bit, and others are also excreted. Okay, there is excretion. Remaining is excreted, like sodium, chloride, all those electrolytes are important here. Okay, now there are some other substances which are only, which are filtered and it is completely reabsorbed. Completely. So it's two examples. Very typical example is amino acid and glucose. Amino acids and glucose, and you know that there is no filtration of proteins. Okay, only amino acids are filtered, and it is not proteins which are filtered. Proteins are not filtered. So what was I saying? That these amino acids and the glucose, it is getting filtered, and without being excreted, it is completely reabsorbed. Whereas what we saw in case of electrolyte is that it was filtered, some was absorbed and some was excreted as well. Whereas in case of the amino acids and glucose, it is absolutely completely reabsorbed. Okay, so creatinine and inulin was completely filtered, electrolytes in between, that's why I've put it in between, and amino acids and glucose, it is completely reabsorbed once it is filtered. Now finally, we come to something which is secretion, the secretory functions of the kidneys. Okay, the secretory functions of the kidneys. Now certain substances in kidney, they are not just filtered, that is they are filtered definitely, and they are also secreted. Rather than absorbed, they are also secreted. So two things happen, they are filtered and they are also secreted. That is, complete elimination is happening. The body doesn't want them, they are completely eliminated. Body doesn't want them. So it's like they are filtered, okay, they are filtered and they are also secreted. So it's like last two columns. And what are the substances which has this role? That is organic acids and bases, organic acids and bases definitely. Okay, and another very important molecule which is PAH. Now three substances which you have to note here is creatinine, inulin and para-aminohippuric acid. These three things will be utilized later on to analyze or assess GFR and the blood supply. So filtration, completely filtered creatinine and inulin, filtered as well as secreted para-aminohippuric acid. Okay, you'll understand this more better later on. Okay, so this are the basic understanding of GFR. Now one question which you would have noticed is that highest fraction of oxygen consumption, that is the kidney uses the highest amount of oxygen for what purpose? Okay, highest amount of oxygen consumption by the kidney is used for what purpose is what is being asked, and the answer for that is sodium reabsorption. So this is just an MCQ question. Okay, for sodium absorption, the highest amount of energy, the highest amount of oxygen consumption is used. So we said there is filtration, and we said there is also something where the blood is coming and getting or being used for the filtration purpose. So now we are going to study about the renal blood flow and its determinants, the determinants of renal blood flow. Now, how renal vascular resistance is controlled? We said it is sympathetic system, then hormones and local mechanisms. Now, sympathetic system, as I've told you, we've discussed this already in pharmacology. Now, one question I just want to ask you here, you might have seen it in our MCQ bank. Now it is that in case of after surgery, if a patient is suffering from pain and you are going to give him NSAIDs, okay, what is the effect on GFR? What is the autoregulation of GFR? The autoregulation of GFR means despite a marked change in arterial pressure, even if arterial pressure is changing, the GFR and renal blood supply is constant. This is what is autoregulation. Okay, now there are two mechanisms by which autoregulation takes place. One is the myogenic autoregulation, and second is the favorite with the tubulo-glomerular feedback mechanism. I'll explain both of them. Okay, so now we'll see the components of it. Now you know it's efferent arteriole is one component, efferent arteriole is another component. So it's coming in, it becomes the glomerular capillaries and going out as efferent arteriole. Simple. Okay, so it's the efferent and efferent arterioles and distal convoluted tubules. So these are the three major components efferent of the tubulo-glomerular feedback. Okay, so why now? What is tubulo-glomerular? The tubulo is the distal tubule. Tubulo. Glomerular is efferent arterioles because they go in and out of the glomeruli. So this is basically what is the tubulo-glomerular feedback mechanisms. Okay, now what subcomponent of these are playing a role here? In the efferent and efferent arterioles, both, there are specialized cells called juxtaglomerular cells. Function will be discussed. Okay, there is this specialized cells here. Okay, These are the juxtaglomerular cells, and in the distal tubules there is another specialized cells called the macula densa here. Okay, macula densa. So it's the macula densa here, and it is the juxtaglomerular cells in the efferent and efferent arterioles. Now you can get a question here. Macula densa is seen in which part of the kidney? Distal tubule, efferent arterioles, proximal tubules, and all those. The next thing I'm going to discuss is about the determinants of GFR. How is, or what decides the GFR? Okay, what controls the GFR?